I think this is an interesting opportunity. What I'm going to talk about is an exercise or tool that we developed during our work in the Northern Neck that Chad talked a little bit about, that launched in the midst of COVID and the pandemic, taking root in our communities and kind of reshaping our lives. And some conversations we were having with two of the counties in the Northern Neck that we worked with, Richmond and Westmoreland County, around their interest in examining vulnerability and how it's expressed in the community around flooding, and sort of a broadened idea of how we think about vulnerability to a particular hazard. So I think that context is helpful because it did help kind of catalyze some of these new initiatives that Chad talked about, including the listening sessions and the Regional Resilience Equity Work Group and mini microgrants. So just to give a little context, Richmond and Westmoreland County had on their checklist some items, their priority checklist items that touched on vulnerability in some ways, trying to understand more about data gaps in what was available, and helping to kind of ground more abstract conversations around flood vulnerability in particular neighborhoods or segments of society that are impacted or have less capacity to respond. So we had an awesome team of students and staff that kind of worked collaboratively with these counties over the course of several months to develop a worksheet and process to facilitate a very thoughtful conversation about impacts and vulnerability. This worksheet, which I will pop in the chat for folks that want to take a look at it, I'm going to share some examples from both counties, is available on our RAFT website, and also kind of has a template there that can be adapted for different types of hazards. So this was developed specifically for flooding, but with the idea that it can be adapted for any type of hazard, like winter storms or heat or wildfires, many of the different types of expressions in which climate change impacts our communities. And the goal is to kind of work through who is specifically impacted to those particular expressions of a crisis or hazard. And then the next step from there is kind of looking at who are the particular communities. So if you can go to the next slide, please, JD, that would be great. Two things regarding the goal that I think is really important is the populations and how we're thinking about vulnerability. So that is not just folks that are directly impacted by a hazard or flooding. So if your house is underwater or your driveway prevents you from accessing grocery stores or health services and things like that, but also populations who are vulnerable in less direct ways, or who have had less resources or education, or are dealing with language barriers or other things that make it more difficult for them to respond in a crisis or event itself, or recover in the long term, which gets at those kind of underlying inequities that exist and kind of undergird disparity in a region. And then the purpose, again, is if we can look at and identify sort of these maybe less obvious populations that are impacted during an event or have undergirding vulnerabilities, it allows for better resourcing, preparation, to make sure that the whole community is able to respond to the impacts of a hazard and recover in a just way. Next slide, please, JD. So the table on the right kind of looks at some of the types of vulnerabilities or underlying conditions that can really exacerbate vulnerability to flooding or any type of hazard. So that can be, income below poverty level, individuals experiencing homelessness, not having health insurance, being underinsured, lack of reliable internet, cell phone coverage and transportation, themes that have come up in the presentation so far. And then again, the experience of historical traumas causing low trust in government, maybe being not sure or not being able to access government services, or again, kind of having historical trust issues there. So these are some of the kind of themes that we were encouraging in this workshop for localities and groups of stakeholders to kind of think about while considering flood impacts. Next slide, please. So in this exercise that we kind of facilitated, piloted, and co-developed this tool over the course of several months in Richmond and Westmoreland County, some of the groups that kind of emerged or were identified by the RAFT implementation teams and counties were kind of some of the groups you might think about or might be obvious: elderly, nursing home populations, or other medically vulnerable groups, including those maybe with physical or mental disabilities, folks with limited mobility, uninsured and underinsured, particularly those who don't have flood insurance or maybe are renting and don't have sort of coverage or capacity to recover loss, folks with poor credit, substandard housing. I think Chad's comment before about what it takes to live in and afford housing is so important here. And then access to personal vehicles. You know, Bay Transit does an awesome job of getting people to jobs and services across the Northern Neck and Middle Peninsula region, but there's still gaps there in terms of people having connections to critical resources and services. And then broadband has been a theme that we heard in Richmond and Westmoreland and in many, many of the rural counties and towns that we work with on the RAFT. Next slide, please. Also, you know, tribes and indigenous people, communities that have had historical trauma and lack of trust with current government, immigrant communities and folks that maybe don't speak English as their native language, often have challenges accessing materials around emergency preparedness that are exclusively in English. And then one of the populations that was flagged in Richmond and Westmoreland County is the Amish and Mennonite community, which I think facilitated a really interesting conversation about resilience, because you know these communities are very resilient in many ways. I think all of these populations here are in many ways, and I think that's important to think about contextually. So with the Amish and Mennonite, it might be more about communication or transit considerations at the same time that the community is extremely resilient in terms of connectivity and trust and sort of supporting each other during or following an event. So these are just some examples kind of coming out of this worksheet process. Next slide, please. So I shared the link to this guide, this worksheet in the chat. And this is kind of there's a lot of details to the process. Like I said, we facilitated this as a pilot with 2 counties. It kind of walks a group of stakeholders through gathering information on flooding or any particular hazard, looking specifically at flooding impacts, so specific damages to infrastructure, property, crops, disruptions to community services, utilities, how the public or environmental health is impacted, and then identifying who is likely to be affected by those impacts. So next slide, please. Just to give you an example of what this looks like kind of filled out and in kind of a rough format as the community is going through this. So for example, in Richmond County, when we are talking about disruptions to community services, water supply, the team recognized how public school interruptions to education, again, which we saw dramatic impacts during COVID, is important to think about, nursing homes and accessibility issues there. And then also water supply, community wells, how those are impacted by flooding and contamination and the fallout from that. So next slide, please. A couple examples from Westmoreland looking at electric utilities. social service provider interruptions. Again, Bay Aging, we have lots of Bay Aging, Bay Transit people here. Meals on Wheels, some of these programs that provide critical services to communities across the region that are interrupted by floods and other hazards, and what that means for communities. Next slide. And then this is an example of that next phase of the worksheet. So like once these specific impacts are identified, who's exposed to those impacts, and then which particular populations or communities are directly impacted. So parents and students without childcare support, for example, when schools are closed, people who don't have personal vehicles, who rely on school buses, things like that. With evacuation, again, people without access to vehicles or are geographically distributed. And then in mandatory evacuations, Amish and Mennonites may need special consideration. So just an example of how this kind of looks on the ground in a particular locality as we start to think through vulnerability. Next slide. And then just another example from Richmond County as well, thinking about structural damages to private residences. You have aging housing stock or lower income people. They might have less resources to retrofit or make their accommodation storm proof and things like that. People downstream from septic system failure. So watermen with ground closures for shellfish, property owners with poor soil. This impacts potentially food production, thinking about food security in that regional resilience equity subgroup. Next slide, please. And then the fourth step of this exercise is identifying who has limited ability to prepare for, respond to, and recover. So really thinking about those three different aspects of resilience before, during, and after in the long term an event. And the particular populations that might, have a real hard time recovering long term because of some of these underlying inequities or lack of access to resources, how barriers like lack of internet can really impede recovery in the long term. Next slide. So for example, thinking about response here, returning home after an evacuation, low income households or people without a car might have limited ability to return. Again, low income capacity to kind of restart, refurnish their homes, things like that are kind of across the spectrum and board with recovery and response. Next slide, please. So where does this take us? The worksheet has kind of a final step for thinking about how these specific populations and gaps around vulnerability can inform things like regional hazard mitigation and emergency operation plans, specific locality resilience or comprehensive plans. In some of our work with Richmond and Westmoreland, we were also doing some exercises around communication strategies. So making emergency preparedness conversations more accessible and comprehensive in meeting people's needs. Also filling data gaps. So recognizing what we don't know in a community or a county, that information can inform grant proposals to do further research or figure out where a project would best be cited. And then of course, as we saw, thinking about interruptions to public services, there's a great opportunity for improving service provision by local government service providers and local organizations when these gaps are acknowledged. As I mentioned earlier, and as Chad and others indicated, these conversations that were happening in Richmond and Westmoreland County in partnership or in parallel with the pandemic really, I think, elevated the need to think about resilience much more broadly than flooding, to really broaden the conversation of who's participating in these discussions around what vulnerability is and what the solutions should be, and did inspire kind of continued work with the mini and micro grant program, listening sessions around how COVID impacted service provision and some asset mapping in the region, with the goal of, let's better prepare the whole community for the impact of hazards. So I'll stop there. I think I'm close to my time, but I did want to just let folks know that that resource, that exercise and tool that is structured for flooding but has an appendix where it can be adapted for any hazard is available to use by a county or town or other community. And I think all of these tools can continue to be adapted as they are piloted, or we continue to expand and grow our understanding of resilience and vulnerability and how to approach it. So I'll stop and see if there's any questions or comments from folks, but thanks for the opportunity to share this.
Well, we're really, I will say that, the development of this tool that Sierra just walked us through was, we never know what is going to happen when we're working with different communities, and really our goal is to be responsive. And this really came out of their request, and turned out to be something very helpful to more than the communities that requested it. So we hope sharing this tool with you is helpful.